Hello, and thank you for joining this employee meeting for participants of Advantage Health Plans. This meeting is for the 2024 plan year. In this employee meeting, we are going to review a few things to help you use your employee benefits in the best way possible. Today we will cover what is Advantage Health Plans, this year's updates to the plan, why is healthcare so expensive, how Advantage works for you, and some resources to help you make good choices. Advantage is not an insurance plan in the way you may think. Advantage is not owned or operated by a third-party insurance carrier like Blue Cross Blue Shield, United Healthcare, or Aetna. Instead, Advantage is a health plan created by a group of community bankers. Bankers like your employer. Bankers like you. In this type of plan, employers in the same industry unite to pool resources, assume risk, and provide benefits for their employees. This is called a multiple employer welfare arrangement, or MIWA. Advantage now operates in Oklahoma, Texas, New Mexico, and Louisiana. Advantage is an endorsed provider of the Community Bankers Association of Oklahoma, the Independent Bankers Association of Texas, and the Independent Community Bankers Association of New Mexico. For more than 40 years, Advantage Health Plans has been the self-funded plan of choice for community bankers. The trust was born out of a creative idea by community bankers back in 1952 and has been in continuous operation since. Advantage Health Plans is the perfect fit for you. It is tailored to the unique needs of the community banking industry and includes the things that are important to community banks and their employees. Advantage is not like the one-size-fits-all approach of traditional insurance carriers. Advantage now provides benefits to thousands of participants from hundreds of employers in Oklahoma, Texas, New Mexico, and Louisiana. Through Advantage, multiple employers flex their healthcare purchasing power. You can see the strength in numbers and why Advantage works. When you think Advantage, think free market healthcare. It's the ultimate in choice and value. What is the price of a hip replacement? With traditional insurance, it's anyone's guess. With Advantage, you are connected with providers who offer valuable care at a transparent price. And since Advantage runs on free market principles, any changes to your contributions reflect actual dollars spent on claims, not the whims of closed-door decision-making at big insurance companies. Advantage contracts with providers who agree to bundle their services at fair, reasonable, and transparent prices. Instead of playing wait and see until you get healthcare bills in the mail well after your procedure date, consumers can now comparison shop for medical services, just like any other product on the market. Advantage works with hundreds of medical facilities and offers thousands of procedures for free. Advantage is governed by an elected board of trustees who use the plan just like you. The board ensures the financial soundness of the plan and approves contributions, makes plan changes, and reviews participant appeals. The board also hires other partners to assist with the overall administration and management of the plan. Advantage is regulated by the Department of Labor and the State Departments of Insurance. Advantage is administered by the Kempton Company. The decision-making power rests with the board, but the day-to-day administration is managed by the Kempton Company. The Kempton Company was founded in 1969 by Wayne Kempton and has been family-owned and operated ever since. The focus of the Kempton Company is on providing exceptional service, forming long-term partnerships, transparently contracting with providers, and reducing the cost of claims for our clients while helping them provide better benefits. The Kempton Company has a core value of revolutionizing the healthcare industry and empowering healthcare consumers. With Advantage, your money doesn't vanish into the pockets of a third party. Instead, it's used to pay for your actual care. Simply put, you own the plan. Every healthcare decision you make is a healthcare purchasing decision. You are the buyer. Your physicians and other providers are the sellers. This is the market equation of healthcare. Every dollar saved helps keep costs low for you, your coworkers, and all other participants of Advantage. Advantage offers multiple plan designs that have different copays, deductibles, and other benefits. Your employer can tell you which plan is available to you and what your cost will be for enrolling in that plan. You can view additional benefits information, like a current summary of benefits and coverage, by visiting www.advantagehealthplans.com. Next, we are going to discuss some changes to your benefits for 2024. Advantage is always looking for new ways to reward smart choices. For 2024, there are even more cost-saving options available to you. Let's get started. Each participating employer contributes to Advantage Health Plans on a monthly basis, but not every employer contributes the same amount. The amount of the contribution is relative to the contribution adjustment category that is assigned to that employer for the year. Contributions can be higher or lower for each employer, depending on the expected claims for that group. To find out what your employer's contribution adjustment category is, please contact your HR department. All plans with Advantage Health Plans include enhanced benefits. Some benefits are covered at 100% where all patient responsibility is waived, and the medical services are free to the covered individual. Participating employers with Advantage Health Plans take your health plan benefits very seriously, and it is important to them that you have valuable health care. Advantage Health Plans includes a voluntary benefit called KPP-free, which pays for medical services at 100%. No deductible, copay, or coinsurance. A KPP-free provider's price is bundled, which means it is all in for all components of the procedure in a single price. Upfront, which means we know the total price going into the procedure with no surprises later. And reasonable, which means when we compare the alternative PPO pricing, the savings can be 50% lower than the network's already discounted price. These KPP-free providers know that cost and quality is how patients like you determine value. We'll talk more about KPP-free later in the presentation. By utilizing LabCard, DLO, Quest Diagnostics, clinical pathology laboratories, or other directly contracted laboratory providers, your laboratory services can be covered at 100%. For a complete list of the labs available under this benefit, visit www.advantagehealthplans.com. The Premier Drug Tier includes some over-the-counter and other prescription medications. The drugs included in the Premier Drug Tier have zero out-of-pocket costs. This means these drugs are free to you. For a complete list of drugs in the Premier Drug Tier, please visit www.advantagehealthplans.com. New drugs can be added anytime. Kempton Direct Access Providers is an enhanced, consumer-driven benefit for primary care, preventative care, and urgent care services. This program allows eligible participants of Advantage to enroll with a direct primary care, or DPC, physician through the health plan. DPC physicians offer medical services through a patient-centered payment and practice model. The monthly DPC fee is paid by the health plan at 100% up to $89 per month. You will have no additional out-of-pocket costs for medical services included in this monthly fee. To learn more about direct primary care and the Kempton Direct Access Providers Program, visit www.advantagehealthplans.com. We'll also talk more about Kempton Direct Access Providers later in this presentation. Please note, under IRS guidelines, participants enrolled in a qualified high-deductible health plan are not eligible for Kempton Direct Access Providers benefit. Finally, Advantage Health Plans offers you the complete freedom and flexibility to negotiate a fair price with any provider and submit an invoice for reimbursement even if the provider is out of network. Special note for participants enrolled in the HD-HP 2500 or the HD-HP 5000. Under IRS guidelines, with the exception of ACA-mandated preventative services, participants enrolled in a qualified high-deductible health plan must meet their deductible before receiving any 100% benefits. Please ask your HR department if you are enrolled in a qualified high-deductible health plan. Let's talk about why healthcare is so expensive. It's no secret healthcare is expensive. At a time when health insurance premiums climb ever higher, businesses everywhere and their employees are feeling the squeeze. Why? Because the way we buy and sell healthcare is fundamentally flawed. How is the system flawed? Health insurance is confusing. Patients are uninformed about the actual costs of healthcare, and more often providers focus on the cost of the patient's copay or deductible. Patients have no resource to determine prices for healthcare. Driving down the highway, one can easily identify the price for a gallon of gas from the billboards posted outside the gas station. Such a billboard doesn't exist for medical procedures outside hospitals. Costs are hidden and high. The doctor-patient relationship has deteriorated, and there's no competition on price or quality. When the consumer is excluded, the system wins. How does the system win, you might ask? Well, displayed on your screen are the stock prices for the big insurance companies since the Affordable Care Act was passed in 2010. You can see how the system has profited from the cost of healthcare skyrocketing. Even though most plans offered by Advantage Health Plans use a network to access local providers, the network price is rarely the best price. This is why Advantage has cost-saving alternatives to help participants save money. It's important to understand what role a PPO network plays. PPO networks negotiate discounts of a provider's billed charge. The providers agree to give this discount in exchange for the network guiding patients like you to their facility. This is the volume for discounts virtue of a PPO network. The more patients a network can channel to a specific provider, the more a provider is willing to discount their charges. But providers actually decide what they want to charge to begin with. Different providers charge different amounts for the same service. Charging higher prices to give higher discounts is one way providers and networks inflate prices while providing the appearance of added value. Even if the PPO network negotiates a discount off billed charges, if the provider's charge is high, the result may not be a good deal for you or your plan. Some PPOs may boast a deep discount of 60 or 80% off, but even 80% off $1,000 still costs more than 50% off $100. Networks rarely offer the best pricing. It's only the appearance of added value. Let's look at an example. The cost of a hip replacement is not widely known. Providers set costs based on an unknown starting point. Without a common reference, price can fluctuate wildly. In this example, the cost of a hip replacement, even within the network, can range from $27,000 to over $84,000. These prices are the network discounted prices. At over 300% variance, and without a reference, it's anybody's guess if either is even a decent price. Let's look at some other examples. Here's a graph showing the price variance for 10 common procedures in a given area. The first area we'll examine is Oklahoma City, Oklahoma. But please note this pattern is repeatable in virtually every area across the United States. Represented, you can see the cost variation between the low price and the high price is extreme. For example, the cost of a sleep study in the Oklahoma City area can range from around $1,000 to over $8,000. The prices shown here are already discounted by the network. That's a variation of over 780% in cost. In fact, the average pricing variation for the medical procedures shown here is over 750%. Does this amount of pricing variation occur in other retail or service industries? It's rare, if not unimaginable. In fact, if we try to put this same pricing variation into context in, say, gas pricing, I suspect you would be appalled to have to choose between purchasing gas at a pump price of $18.93 versus $2.50 per gallon. But in healthcare, this is common. Healthcare buyers should be empowered with this information to make their own choice about healthcare. Let's look at some other areas. In Albuquerque, New Mexico, the healthcare market variation averages about 650%. In San Antonio, Texas, the healthcare market variation averages almost 680%. In an Austin, Texas market, you can see pricing variation average over 580%. This market variation makes it incomprehensible that the network provider can guarantee you a valuable price. Providers rarely offer their best price to a PPO network or insurance company. Often, their best price is reserved for those who can pay cash. The bills displayed on your screen are bills from a patient who had an emergency room visit. The patient did not provide their medical insurance ID card to the hospital prior to treatment. Without a copy of the member ID card, the patient was listed as a self-pay or cash pay patient. The patient received a bill for the medical services for $1,000. The patient assumed, as most of us would, that it would cost him less if they refiled the claim with his insurance company. Since the hospital was in-networked, he believed the network discount would reduce the charges. After the hospital filed the claim with the patient's insurance carrier, they sent a new bill a few months later. The patient was now being billed $1,752.80. The amount the patient owed increased after the bill was filed and the discount was applied. It seems backwards that after a network discount, a patient would owe more, and it is backwards. What can you do about any of this? What is the healthcare solution? Advantage is the solution. Advantage helps community banks like yours keep costs contained through member-owned, self-funded, consumer-driven benefits. Advantage programs are consumer-driven, bringing transparency, value, and savings to employers and employees alike. By putting power in the hands of the healthcare consumer, individuals and the plan as a whole benefit. You will be receiving a new member ID card for this year. When you receive your new card, please destroy your old one. Be sure to give your medical providers an updated copy of your new card. You can request new cards or print a temporary card from www.advantagehealthplans.com. If you are enrolled in a Select, Value, HDHP, or MVP plan design, your plan uses a PPO network to provide access to providers in your area. On the front of your card is the PPO network that your employer has chosen to access. Be sure to check the network status of your medical providers prior to seeking medical care. You can check the network status in the following ways. Contact your medical provider and ask them whether they participate in the PPO network that you access. Visit www.advantagehealthplans.com, and from the quick links on the home page, click on Find a Doctor or Pharmacy. Then scroll down to the list of provider networks and select the corresponding network, or contact Advantage Health Plans. Please note that there are some providers that are excluded from the network. Please visit www.advantagehealthplans.com to learn more about which providers are considered out of network. If your network changed this year, be sure to check network status for your providers prior to seeking care. If you are enrolled in a choice plan design, your plan does not use a PPO network. The plan's payment to your providers will be indexed to a reference-based price. Some pricing variation is expected and even tolerable. There's always pricing variation. Most products we buy have an agreed-upon price set by the interaction of the buyer and the seller. Consumers make decisions all the time about their comfort level with pricing variation. Just think about the last purchase you made. If you were comparing TV prices, you might expect to see Amazon, Best Buy, and Walmart all carry the same TV at different prices. It's common for pricing to vary over 100%. In healthcare, the pricing variation is 7 times that. To tip the balance in the favor of the consumer, Advantage weighs publicly available pricing data to determine a reference price. It's the ultimate freedom and flexibility, benefits you wouldn't have with any other carrier. Some common references that can be used to determine fair pricing are things like Medicare, the largest single payer of healthcare goods and services in the United States, a free market cash price, such as that available through the KPP Free program, Healthcare Blue Book, which gives you access to market pricing, and even places like Amazon. One way Advantage protects the plan from unreasonable charges is through reference-based pricing. For example, for the plans that utilize a PPO network, all out-of-network medical services are covered at the same benefit. Participants are not penalized with higher out-of-pocket costs for using an out-of-network provider. However, the provider's reimbursement is limited to a percentage above their current Medicare rate. The choice plan designs have no PPO network, with reimbursements for all medical services limited to the percentage above the medical provider's current Medicare rate. Physicians are reimbursed at the provider's Medicare rate plus an additional 30%. Facilities are reimbursed at the provider's Medicare rate plus an additional 60%. Emergencies are allowed at the provider's Medicare rate plus an additional 100%. Another example of reference-based limits is for an implantable medical device. Implantable medical devices are limited to a planned payment of invoice plus 100%. That means that when Advantage Health Plans receives a claim for a procedure that involves an implantable medical device, we will request an itemized bill from the medical provider. Using this itemized bill, the implant charges are separated from the rest of the facility charges. The facility charges are paid at regular benefits. Then the implant invoice is requested. The plan will allow the medical provider to recover 100% of their cost subject to an implant invoice, plus an additional 100% profit. Any difference between billed charges versus the reasonable plan allowable could be balance billed to the participant. Please take time to become familiar with these and other reference-based limits in your plan, which are designed to protect you from unreasonable charges. Let's take a look at a procedure that involves a reference-based limit for implantable medical devices so you can see how inflated some pricing really is. In this example, you can see a knee replacement. This is a pretty common procedure that involves an implantable medical device, the knee joint. In this example, billed charges for this procedure exceed $238,000. The PPO's negotiated discount brings the allowable down to about $167,000. But let's look at the portion of the charges that are just for the implant. Of the $238,000 billed charges, $118,000 is for the implant. The PPO allows about $89,000 on the implant charges alone. But remember, under Advantage, we request the implant invoice. Think about it like this. When you go to the hardware store and purchase a hammer for a construction project, you get a receipt for your purchase. The same is true for the implant. When a provider purchases the knee joint, they receive a receipt for the purchase. The invoice, or the provider's receipt for the purchase, shows that the provider paid $4,365 for the implant, the knee joint. The provider is billing $118,770.50 on that implant. and the PPO is allowing $89,077.88 to be reimbursed under the plan. Because of the reference-based limit built into Advantage for your protection, the plan only actually reimburses $8,730. That's a pretty big difference. It's notable that on a procedure which originally costs $238,000, the KPP-free bundled price, including the implant, is just over $23,000. That price is available at one of our KPP-free providers who is a nationally recognized leader in orthopedics and sports medicine. Let's take a look at a procedure that involves a reference-based limit for intraoperative nerve monitoring. Intraoperative nerve monitoring is a technique used during surgery to monitor the condition of a patient's nervous system throughout the surgical procedure. This is a separate medical service and requires separate medical providers than the actual surgery itself. The reference-based limit is a max of $4,000 for intraoperative nerve monitoring. Advantage arrived at this limit after analysis with providers, taking their input about the reasonable reimbursement level. Here we see a cervical spinal fusion. Billed charges were $294,000. The PPO would discount those charges and the provider would accept $127,000 as payment in full. The portion that represents the intraoperative nerve monitoring charges is $129,733 of the original $294,000. The intraoperative nerve monitoring plan limit would allow $2,514.98. In this particular example, the intraoperative nerve monitoring provider is out of network, so the charges have been indexed to Medicare. This means that Medicare would pay and the provider would accept about $2,000 for this $129,000 charge. Another significant difference between the inflated billed charges versus the reasonable plan allowable with the reference-based limit. Here are a couple more examples on reference-based limits. Advantage includes a reference-based limit for air ambulance indexed to 120% of Medicare, and for dialysis indexed to 240% of Medicare. Here's what you need to know. These limits have been placed with much consideration and with cost containment in mind. It's possible that a provider may choose not to accept the amount that the plan pays. In the event that a provider does not accept the plan reference-based limit, you may be balance billed for the difference. Don't panic. Call Advantage. There may be support available to assist you with working with the provider. In most situations, it is important to seek a commitment from the medical provider to accept the plan benefit prior to receiving care to help avoid balance billing. Remember, using the KPP free program protects you from any balance billing and also ensures the best price. It is important to contact a Kempton Care advocate prior to having any non-emergency medical procedures so you can be informed of any additional plan limitations. Let us help you with your benefit options. Advantage participants can get some care for free. All plans include the KPP free program, which pays for medical services at 100%. No deductible, no copay, no coinsurance, no out-of-pocket costs. Advantage offers a 100% benefit for services available under KPP free as an enhanced benefit because these KPP free providers offer their best prices to your health plan. You are getting the best deal out there by using a KPP free provider. This voluntary benefit is for non-emergency medical procedures when you have time to plan. Your plan has options through KPP free for a variety of medical services ranging in cost from a few $100s to tens of thousands. But it only takes one. The impact that just one single claim can have is huge. When you use KPP free, you are making a better buying decision. Providers in the KPP free program are excited to offer their best price to members of their community, and they know that working directly with Advantage is a great idea. There have been over 76,000 procedures performed under KPP-free for our clients, and the savings have been over $122 million. Those results don't even calculate the savings achieved by each participant because they didn't have to pay anything towards their out-of-pocket costs. So the procedure was completely free. You can see how this can add up. Please note, under IRS guidelines, with the exception of the ACA mandated preventative services, participants enrolled in a qualified high-deductible health plan must meet their deductible before receiving a 100% benefit. This program is for non-emergency situations. For emergency situations, please seek medical assistance immediately. Refer to your plan document for emergency benefits. A KPP provider's price is bundled, which means it's all in for all components of the procedure in a single price. Up front, which means we know the total price going into the procedure with no surprises later. And reasonable, which means when we compare to the alternative PPO pricings, the savings can be 50% lower than the network's already discounted price. These KPP-free providers know that cost and quality is how patients like you determine value. Often participants ask about the quality of a KPP-free provider. How can a provider's charges be so much less? This is a great question. As some KPP-free providers have explained, quality outcomes are carefully measured since they are choosing to offer their best price to this health plan. The providers ensure their profit margins and reputation remain intact even at the competitive rates that achieve so much savings. So KPP-free providers exercise high levels of discretion when selecting the physicians and procedures eligible to participate in the program. Quality is also somewhat self-selecting through the KPP-free program. Can you imagine if a participant made the choice to change providers to a KPP-free provider and then had a terrible experience and problems with their medical service? Market influences, aka water cooler talk, would pretty much guarantee that provider wouldn't get too many more patients. We agree. You should consider quality and cost when you consider the value of the KPP-free program, and patients should hold providers accountable for quality outcomes and reasonable charges. Your plan makes this possible. The program has been successful since it started in 2012, growing from one provider to 100 plus providers in multiple states. There are now more than 2,000 procedures and services available through KPP-free. Participants can search for KPP-free providers and procedures, receive vouchers, view upcoming appointments, and communicate with a Kempton Care advocate through the mobile app. Search for KPP-free in the Google Play or App Store to find the app. Many medical services are available through KPP-free, such as orthopedic procedures, diagnostic imaging, general surgeries, urology, ear, nose, and throat, gynecology, oncology, inpatient cardiac testing, bariatric, digestive testing, sleep studies, and more. To see a list of KPP-free providers and eligible services, visit AdvantageHealthPlans.com. Using the KPP free program is as easy as 1, 2, free. To learn more about the KPP free program or start the process, contact Advantage Health Plans and speak to a Kempton Care advocate. Step 1. After your provider indicates that you need surgery, diagnostic imaging, or another procedure, tell them that you have a 100% benefit and need a copy of the orders. When you have a copy of the orders for the procedure, give us a call to get started. The Kempton Care advocate will start the process and walk you through the steps. Step 2. Once your procedure is scheduled, you will receive a KPP-free voucher. Step 3. At your appointment, present the voucher to the provider instead of your member ID card. Your procedure will be covered at 100%. Remember that under IRS guidelines, with the exception of the ACA mandated preventative services, participants enrolled in a qualified high-deductible health plan must meet their deductible before receiving a 100% benefit. This program is for non-emergency situations. For emergency situations, please seek medical assistance immediately. Refer to your plan document for emergency benefits. Kimpton Direct Access Providers is an enhanced benefit for primary care services delivered by a direct primary care provider, or DPC. This program allows eligible participants of Advantage to enroll with a direct primary care physician through the health plan. Direct primary care is an innovative, proactive, consumer-focused approach to everyday care. Instead of filing claims through insurance, patients and doctors work together in a buyer-seller type relationship. Direct primary care physicians offer medical services through a patient-centered payment and practice model. Direct primary care is for everyday healthcare needs that covers most primary care, urgent care, and preventative services. Advocates of direct primary care enjoy the benefits of relationship-based medicine, a set monthly fee where eligible services are included at no additional cost, and patients have unrestricted access to their provider, including virtual visits. Patients report being healthier and happier in their direct primary care relationships. Through the Kimpton Direct Access Providers Program, Advantage participants can enroll with a participating direct primary care physician through the health plan. The monthly fee is paid by the health plan at 100%, up to $70 per month. Participants will have no additional out-of-pocket costs for medical services included in the monthly fee. Costs for services not included under the monthly fees are the participant's responsibility and may fall to regular plan benefits. To learn more about direct primary care and the Kimpton Direct Access Providers Program, and to get a current full list of direct primary care physicians that participate, please visit AdvantageHealthPlans.com. Remember that under IRS guidelines, participants enrolled in a qualified high-deductible health plan are not eligible for the Kimpton Direct Access Providers benefit. An extension of the KPP free program is the Cash Price Agreement. A cash price agreement allows you to use the KPP free benefit with any provider. That means you can turn any provider into a KPP free provider. The cash price agreement offers the ultimate in flexibility and choice. Your provider can choose to match or closely approximate the bundled KPP price for you to get the same 100% KPP free benefit. The facility, surgeon, anesthesia, and other related services must be bundled, just like with KPP free. Cash price agreements are negotiated between you and the medical provider. To get the details to talk to your provider about a cash price agreement, please call to speak with a Kimpton Care advocate. Remember that under IRS guidelines, with the exception of ACA-mandated preventative services, participants enrolled in a qualified high-deductible health plan must meet their deductible before receiving a 100% benefit. This program is for non-emergency situations. For emergency situations, please seek medical assistance immediately. Refer to your plan document for emergency benefits. Advantage partners with Livinity as the Pharmacy Benefit Manager, or PBM. Livinity was founded by clinical pharmacists, and their focus is to deliver positive participant experiences and achieve successful outcomes while reducing costs. The Livinity logo is included on your member ID card, as well as other important information for your chosen pharmacy. Livinity RX group number is AHP 100. Advantage offers multiple plan designs that have different prescription benefits. Your employer can tell you which plan is available to you. Please check www.advantagehealthplans.com to access more information about Livinity, find a first choice participating network pharmacy, and more. Advantage also partners with Scripta, a service that uses real-time claims data to recommend alternative medications that will save employees and employers on their prescription claims costs. Scripta's team of doctors and pharmacists review your prescriptions, and if they find a better price, Scripta will automatically provide personal recommendations. Be on the lookout for communications from Scripta. They may come via email, text, or snail mail. You can also view your personalized savings report by logging into the member portal at AdvantageHealthPlans.com and then choosing Scripta in Quick Links. Advantage recently announced a new partnership with Script Sourcing that provides a unique opportunity to help participants save money on special medications. Script Sourcing is an international pharmacy management firm that has been sourcing medications for employers for 2 decades. Script Sourcing provides the most competitive pricing for expensive specialty and name brand medications by sourcing from other Tier 1 countries such as Canada or the United Kingdom, which have the same or higher standards as the FDA in the United States. The types of medications that qualify for this unique opportunity are specialty biotech medications for the treatment of severe medical conditions such as HIV, multiple sclerosis, cancer, and therapies for rare genetic conditions. Medications filled through Script Sourcing will have no copay or out-of-pocket cost to the participant. This change impacts approximately 50 participants of Advantage who will benefit from either international mail order or the manufacturer assistance program through Script Sourcing. Participants eligible for this opportunity will be contacted directly by Script Sourcing. For assistance with all of these prescription benefits, please speak to a Kempton Care advocate at Advantage. Here are some final reminders about how you can talk with your physicians about cost. Always ask your medical providers what the total cost of your medical treatment will be. Remember that your Kempton Care advocates can assist you with identifying your benefits and your plan design. But as a participant on a self-funded benefit plan, you should be asking for the total treatment cost before you have non-emergency medical procedures. Remind your providers that you are enrolled in a self-funded benefit plan for which your employer pays your claims. Tell them that you have certain medical procedures covered at 100% and that this enhanced benefit can also apply to services offered by them if they are willing to match the KPP free price. If you are using an out-of-network provider or are enrolled in a choice plan, ask your provider if they are willing to accept your plan's Medicare reference-based price as payment in full without balance billing you. Register today for the member portal at AdvantageHealthPlans.com. You can search for providers and pharmacies as well as view handouts for all your plan benefits. You can also log in for information about your claims or the status of your accumulators for the year. Thank you for joining me and thank you for being a participant of Advantage Health Plans.